Are you okay with your diabetes? Are you unknowingly ignoring your risk of lower limb amputation? If this makes you worried, please don't struggle alone. In this video, we'll explain in detail the characteristics of people with diabetes who are at high risk for limb amputation. Understanding why this risk exists and how to avoid it will surely help protect your future. If you or your loved ones have diabetes, this is information you absolutely need to know. Please watch until the end. In the latter half of the video, we'll also provide specific advice on how to reduce your risk. If you like this video, please hit the subscribe button and give us a thumbs up. The first type of person at high risk for diabetic limb amputation is those with diabetic foot complications. For example, if you develop ulcers or gangrene on your feet, they might not heal and worsen, potentially leading to amputation. A common characteristic is that people often don't notice and neglect foot injuries. This happens because neuropathy makes it difficult to feel pain, a common symptom in diabetes patients. Are your feet okay? Are any injuries or burns getting worse? If you have even the slightest concern, let's start checking right away. Just one oversight might dramatically change your future. There's no gamble with your health worth taking, nothing that makes it okay to ignore these signs. Next are those with concurrent infections. When foot wounds become infected, treatment can become difficult and the condition can worsen. Diabetes patients in particular have weakened immune systems, making them less resistant to bacteria and viruses and more prone to infection progression. Once infection spreads, amputation might become the only way to save your life. Have you noticed any redness, swelling, or heat in your feet? If you notice anything unusual, please have the courage to consult a doctor. Taking early action protects your future. Only those who act immediately upon noticing something can significantly reduce their risk. Third are those with inadequate blood sugar control. When high blood sugar continues for long periods, it causes serious damage to blood vessels and nerves. As a result, wounds heal more slowly and the risk of infection increases. Furthermore, poor blood circulation means oxygen and nutrients can't reach the extremities properly, increasing the risk of foot complications. Have you been checking your blood sugar levels recently? Are you satisfied with the results? Daily control supports your future self. Letting your guard down threatens not just your feet, but your entire body's health. Your future can be changed by the choices you make today. Finally, there are those with chronic complications. If you have diabetic nephropathy or peripheral arterial disease, PAD, the risk of blood flow disorders and infections increases further. As these complications progress, they can lead to limb amputation in the worst cases. Are you thinking, this doesn't apply to me? Chronic complications have often progressed by the time you notice them. If you feel something's not right, taking that first step could save your life. While you remain unconcerned, the risk silently creeps up on you. Please take action now to protect yourself and your precious feet. If something feels wrong, today is the day to take that first step. We've discussed 4 key points about people at high risk for limb amputation with diabetes. First, those with foot complications need special attention. As diabetic foot ulcers and gangrene progress, the risk of amputation increases dramatically. Next, we explained how having an infection, especially if it's resistant to treatment, further increases the risk. Additionally, when poor blood sugar control continues, it leads to worsening nerve and vascular damage, increasing the possibility of limb amputation. Finally, we explained how those with chronic complications, such as diabetic nephropathy or peripheral arterial disease, PAD, face even higher risks as their conditions worsen. What did you think about today's discussion on diabetes and limb amputation risk? Taking time to face your health is the first step in protecting your future. Foot care is an important habit of self-care, and it becomes the power to protect your life. No question is too small. Please share in the comments section, and if you found this video helpful, please subscribe and give us a thumbs up. Your first step opens the door to a healthy future.